Hi everyone, my name is Alex Borsak. I'll be talking very briefly here about complementary and alternative medicine in nursing, also known as CAM. So the objectives here tonight are going to be to define complementary and alternative medicine, or CAM, differentiate between the Eastern and Western interpretations of CAM using two examples, and identify roles within Western medicine where CAM may be incorporated into medical treatments. So first of all, just a very brief definition from Samani, Ali, and Lalani. CAM is a set of practices and products of which are not part of the science of medicine. However, I'll add in there as well that they can be used to treat, or at least attempt to treat, an illness or to complement treatment of an illness. And this brings us into the interpretations from the Eastern version of alternative medicine, which considered it not alternative, but it is actually the medicine, and Western, which is alternative. So Eastern views basically that these things, such as like acupuncture, aromatherapy, etc., provide an actual medical benefit. They harmonize the qi. They harmonize the soul and mind and body of the individual. Western views of alternative medicine is that exactly that. It's alternative. It's complementary to the scientific version of medicine that we use here in the United States and in the Western part of the world, where they rely on medicines, pharmacology, rely on the science and pathology of disease to treat problems. Roles in which CAM may be implemented. A lot of what I've found recently is that there's a big following of the Western version where it's going to complement the treatment, particularly in oncology and pediatrics, where you're trying to the person's just overwhelmed and tired through their chemotherapy treatments. So you're trying to kind of build that person up by addressing the psychosocial needs of that person, by getting them to focus away from the disease and focus on themselves as a person instead. And in pediatrics, it's used as an adjunctive to occupational and or recreational therapy, so you can actually try and actually develop some different goals, develop some different functional skills, while having enriching the mind, body, spirit of the pediatric as well. A lot of what we talk about in nursing school in the pediatric section is playtime is just as important, is just as educational as study time, and this is this concept of CAM is just reinforcing that. So as a summary here, CAM may be beneficial therapy to reduce stress and allow the patient to refocus the attention on themselves and not on the illness that they're being treated for. And the caution here has to be that they're not using CAM to actually try and treat the disease. And you get that, you have to be careful, especially if you have a lot of Eastern-oriented patients. One study in oncology found that even though they preferred the CAM methods, they did the Western medical treatments because that's what was expected of them, but they still found that CAM was a very good means of relaxation. And the question is, in what way could the Western version of CAM be applied to in your unit? And these are the references. Again, you can take a look at these on your own time. Thank you very much. I hope this was informative, and I look forward to reading your responses. Thank you.